Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Today I am providing a special update on COVID-19 in our province. I am not providing a situation update today, but our website will be updated at 3:30 p.m. with the latest case numbers as usual. This will include the latest numbers on active cases and outbreaks in Alberta. Since the beginning of the pandemic, I have been fully committed to transparency and providing the public information as we have it. As part of that commitment, today, I wanted to tell you directly that Alberta Health Services has identified Alberta's first case of COVID-19 likely transmitted within a school. This is not unexpected and is not a cause for alarm. However, I know that many are anxious about school safety, and I felt it was important to share this information with you and to talk about what it means. The transmission was identified at Waverley School in Edmonton. To date, AHS has identified 2 cases that were infectious while in the school, one of whom seems to have been the source for the other. While it is always difficult to say with 100% certainty where transmission happens, given the facts in this situation, it seems to be a likely explanation. All parents, guardians, and students of this school have been notified by the school within the last few hours and will be receiving additional information from AHS this afternoon. Anyone potentially exposed has been or will be contacted and asked to self-isolate. As I have stressed with previous outbreaks, it is critical that we do not shame or stigmatize individuals with COVID-19 or their close contacts. COVID-19 is a reality for all of us. These students and staff and all their close contacts should be treated with support and understanding. As I mentioned yesterday, even with the cautious approach we have been taking, we expected that we would eventually see some examples of transmission in schools. AHS is investigating and will assess, in collaboration with the school, school authority, and Alberta Education, if any additional measures are needed at the school. At this point, there is no evidence to suggest that the school will need to transition to a different learning model or that other staff and students are at risk. Parents with a child in that school need to know that this school has done nothing wrong. The school should not be targeted with accusations of being unsafe. In particular, I want to ask media to not target this school, as I have heard happened at Sir Wilfrid Laurier's school in Calgary when their number of cases exceeded 5, moving them to a watch level. Parents, teachers, and students are already worried and trying to sort through the challenge of having their school identified in the news. This is made worse by media going on site to interview members of the school community. Let me repeat that it was inevitable that transmission would happen in a school environment. Our commitment is to minimize this, prevent onward spread, and continue to learn and adjust. Blaming or shaming interfere with these goals rather than helping. Across the province as of this morning, there have been 78 cases of COVID-19 who attended school while infectious. Currently, only 57 out of the 2,415 schools in the province have reported an infectious case that attended the school. To date, the episode I am speaking about today is the only time where it seems that transmission likely happened in the school. Managing transmission in schools is part of learning to live with COVID-19 and the reason we have aggressive public health measures in place. Identifying in-school transmission potential quickly and taking action is crucial to limiting the spread and keeping schools safe. This is, however, another reminder that COVID-19 is part of our new normal. As I've previously mentioned, the more cases we see in the community, the more likely we are to see COVID-19 in schools. We all have a role to play in limiting the number of these infections, preventing large outbreaks, and preventing onward spread of sporadic cases. And if we all continue to follow public health measures, we can push overall active cases down, which will help students remain in the classroom. We need to keep working together to keep each other safe, both from COVID-19 and from a need for more aggressive restrictions inside or outside of schools. We can all help prevent outbreaks by being extra diligent in the weeks ahead. Living with COVID-19 means seeking balance between limiting the harms of COVID and limiting the harms of COVID restrictions. As always, I continue to monitor new evidence as it emerges and will adapt my advice on the school reentry plan if needed. We are all in this together, and we are all still protecting each other. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Our first question comes from Don Braid of the Calgary Herald. Your line is open.
Dr. Hinshaw, I wonder if you could give us some idea of the people who have been is infectious while at school, and in this case of the Waverley School in Edmonton. I'll ask one question on that, and then I have another one I'd like to ask you too, but I'll give you that now, of course. Are any of these people, these young people and staff members, I suppose, really sick? How many, can you tell us if any of them are really ill? How many recovered? Are any in hospital or any in ICU? That's number one. Number two, you made a lot of shaming today, blaming and shaming. You've often talked about this before, but today you're particularly strong on it. If you're wondering, you're beginning to see a lot of this going on, and is this escalating, and is it, in your view, dangerous?
Thank you for the question. So to date, none of the students or staff that are cases that have been reported as having been infectious while in a school are, to my knowledge, or have been sick enough to require any kind of acute care treatment. So none that I know of have been in hospital or in ICU. And with respect to recoveries, I would have to go back and work with the team to get that precise number for you. But those that became ill starting in late August or early September, who may have attended school while infectious, would be considered to have recovered again within they wouldn't be infectious within 10 days of the start of their symptoms. So some of those certainly have recovered. And there are some individuals who had been asked to stay at home for 2 weeks, where that 2 weeks has ended. And so some of those close contacts in classrooms are starting to go back into schools. The second question about the shaming and blaming, what I've heard is from school stakeholders. So I've had the opportunity, and I'm very grateful for that opportunity, to meet with different school stakeholders. I also hear input from my colleagues who are on the ground in public health, and in their conversations with local schools and school boards, just hearing about some of the anxiety that's caused in those local schools when there is a significant amount of attention. So we had the first outbreak we declared was in a high school in Calgary, again with only 2 cases who were infectious. And that high school received quite a bit of attention, with lots of people implying that people who attended that school maybe weren't safe to be around, or that the school itself was perhaps a bad environment. We heard, again, reports of and again, I understand that this is a topic that everyone is very interested in and concerned about, but still we did hear reports of distress and anxiety in parents and students of the St. Wilfrid School when their school moved into that blue watch level. And again, knowing that this is the first case where we believe that it is likely that there was in-school transmission, I just want to forestall that I guess the natural human interest in getting more of the story, but recognizing that these individuals who attend this school are no different from anyone else. They're doing the best they can. This just happened to be this first place where this transmission happened, but it doesn't mean that this school is bad or wrong. And the people who attend this school, again, they should not be treated as if they themselves somehow have done something wrong. And I just really feel that if this tendency perhaps of pointing fingers or blaming is strong, then people will not choose to get tested. They may not choose to disclose symptoms. And if COVID-19 goes underground and we're not able to understand how it's spreading, it will cause more harm. And so again, I really want to advocate for the collective approach to support and encourage each other, and where we identify where perhaps an error was made, that we do our best to correct that and move forward. So if somebody did attend school, again, while they had mild symptoms, We obviously don't want that to happen, but we also need to make sure that people have all the supports they need to stay home if and when they are mildly sick.
All right, we'll go to the next caller. Just a clarification, while Dr. Hinshaw said Sir Wilfrid Laurier, the case she was referring to was actually in St. Wilfrid.
Oh, I'm sorry.
Operator, could you put through the next caller, please?
Our next question comes from Alec McCraig of Chat News. Your line is open.
Hi, Dr. Hinshaw. I mean, we're kind of follow up on my question yesterday. I mean, we're hearing a lot from parents. Some of them might have multiple children, having to isolate, and at different times, or possibly themselves. And just wanting to know if there's going to be any adjustments to the requirements to send kids home. Is it just going to be a sniffy nose, or is it going to be prolonged? Or are there going to be any adjustments to kind of take in the whole picture that parents are being faced with right now, with work and school?
Absolutely, and I know it is really difficult. One of my children a few weeks ago had a bit of mild symptoms, and it threw a wrench into our lives too, trying to figure out how to manage that, keeping separate, making sure masks were worn at all times, all of those things, getting a test. And I think there are a couple of things that we're doing to try to make it easier for families, because I know that this is a burden, and again, this is a significant burden, especially for those who may not have family supports or other supports, and maybe have jobs where it's difficult to take time off work. So 2 things we're doing. Number 1 is making sure that we are doing everything we possibly can to shorten the turnaround times for testing. So if a parent has a child with a bit of a runny nose that's unusual for them, again, we recognize that some children have allergies or other conditions where they may have ongoing symptoms that may be similar to COVID-19, but are about the same that they always experience. So as long as that child has had 1 negative test, unless their symptoms change, again, the requirement is simply that they be monitored for that change in symptoms. But if a child has new symptoms that could be COVID-19, one of the things that we are doing is trying to make it as quick and easy as possible for parents to get their child tested quickly, get the result quickly, and as long as their child is feeling better at that point, so it may have been a bit of a runny nose that lasted for a couple of days, and they have a negative test result that's coming back, then that child can go back into school. So we're hoping that decreasing those lab turnaround times will help families in that situation. With respect to those who are needing to stay home with students who are part of a larger classroom where 1 person was infectious, again, we're working very hard to look at all of the cases that we've had over the last couple of weeks to determine where we are seeing that potential for transmission risk, to be able to target close contacts more precisely and not require a whole classroom to stay home. So I am asking for patience. I know it's hard, but just over the next several weeks, as we get that data in and we're able to make the best possible decisions, we want to inconvenience people as little as possible, but also not set up a situation where COVID-19 could possibly spread throughout a school environment. That's obviously what we all want to avoid.
Operator, could you put through the next question, please?
Our next question comes from Kevin Nimick of CTV. Your line is open.
Hi, Dr. Hinshaw. Why do you feel that reporting on the realities in Alberta schools and reporting perspectives about those realities from parents, for example, is targeting the schools? Also, what do you think the role of the media is during this pandemic?
I believe it's critical for the media to report perspectives, to report diverse perspectives, and to report accurately on what is happening in Alberta schools. My concern is the sort of physical presence of media on a physical location, or if media were to choose to I guess, amplify one perspective over and above others, where, again, not telling that whole story about, again, we have 57 schools where there have been exposures and well over 2,000 where there haven't been. So I think the responsibility and the role of media is to report all the facts, to make sure that the public has access to accurate information, to make sure that information is shared along with a diversity of perspectives. And if there are parents or students who wish to share their stories, they should not be constrained in doing so. But what I feel is really important is to make sure that that is done while respecting the impact that that has on that overall school community, particularly where, again, that particular school, in this case, as I'm talking about Waverley today, has not done anything wrong. There's nothing bad about them. They just happen to be the first. We will likely see more cases of transmission. And so it's that balance, I guess. I'm asking everyone to seek balance, and I'm asking media to seek balance as well, to make sure that the story is told accurately, that perspectives are sought and portrayed, and that that's done in a way that doesn't put people at risk of heightened anxiety and the challenges that come with trying to live through this in a school that's experiencing something that's the first to experience a particular issue.
All right, we've got time for 3 more. Operator, could you put through the next caller, please?
Our next question comes from Jason Herring of Post Media. Your line is open.
Good afternoon, Dr. Hinshaw. This morning, Prime Minister Justin Trudeau announced that COVID Watch is coming to Saskatchewan and New Brunswick today, the app for exposure notification. The federal health minister also indicated Alberta was joining today. Can you provide an update on when Albertans will be able to join this app or where the province is at in this process?
It was announced several weeks ago that Alberta has determined that we will be eventually using the federal app. However, there are several details that still need to be worked out, and at this moment we don't have a firm time frame on when that will go live in this province.
All right, operator, could you put through the next caller, please?
Our next question comes from James Keller of the Globe and Mail. Your line is open.
Hi, Dr. Hinshaw. Based on what you know about what happened here, do you expect more cases to be identified within this class as part of some larger cluster or outbreak? And can you just talk about how tricky it is to prevent spread, keep people apart, those sorts of measures when we're dealing with these younger grades?
Sure. I think it's possible that we could see additional transmission. Again, we'll be monitoring that closely over the next several weeks to determine. But the point I would make about transmission within a school environment, the vast majority of cases that have been reported where my colleagues at the local level have given me some information about what's happened, is the transmission that has happened in the community to then result in an exposure in the school has been in settings where children are perhaps in very close contact with others for prolonged periods of time with no additional precautions, so no use of masking, no screening for symptoms, that kind of thing, perhaps more informal type gatherings. We can see in schools that we do have additional layers of protection over and above these more informal community settings. And so I believe that those layers of protection will help. However, younger children, of course, need to interact with each other in a way that is less formal, perhaps, than adults. So again, as with anything else, it's a balance. We need to make sure that children have an environment that supports their educational needs, their social needs, their learning needs, their development needs. And so all of these things are trade-offs where we're doing our best in those environments to manage that risk, but we can't entirely eliminate it because COVID-19 is not the only risk our children face. So again, this is about balance. We may see additional spread, but we need to think about the overall health of our children and of our communities, which is why we are having to, again, hold those two things in tension as we move forward.
All right, operator, could you put through our final question, please?
Our final question for today comes from Linda Olson of Global News. Your line is open.
Hi, Dr. Hinshaw. You mentioned getting children tested as quickly as possible. Kindergarten to grade 12 students in BC will be able to now use a mouth rinse and gargle test for COVID-19, which apparently they can do quite easily on their own. Is this something Alberta's looking into for ease of use for children and quicker testing?
We are working with our lab to look at options such as the mouth rinse and self-saliva sample, but there are different elements that need to be put in place before that can be used broadly. So we need to make sure that that methodology will work with the way that our lab runs tests. We need to make sure that we have adequate collection containers, all of those different pieces, because of course all of the hardware and infrastructure that goes along with a new sample methodology needs to be validated and make sure that it does provide an accurate result. And that work is underway in Alberta, but I don't have a timeline as to when it might be able to be moved forward.
All right, thank you all for joining us. Dr. Hinshaw will provide another update on Monday afternoon. Have a safe weekend.